Hello everyone, it's Carol Kate over here. Happy Nurses Week to all the nursing students and all the nurses out there. I am very proud of all of you guys and for everything that you do. I just wanted to make another video. Sorry I haven't been updating. I did make some videos but they got deleted. So here it is. I'm in bed and I've made something out of my heart and my soul out of nowhere, and let's have a heart-to-heart talk. I have been working for about over 3 months now in a neuro-tele progressive care unit, and let me tell you, it can be really hard because not only am I worried about people's stroke or change of mental status, but also I'm worried about their heart and everything. And it takes a lot of patience and it takes a lot of hard work to be in this type of unit. Nursing school taught me a lot of things. But also you learn most of the things during your orientation with your preceptor or as yourself after orientation when you're going through everything alone. So usually in a progressive care unit, which is a step down from the ICU, you get 12 weeks of orientation, whereas med-surg floors, you get about 9 weeks of orientation. And just because progressive care units are more critical and higher acuities, they come from ICUs, the patients come from ICUs, and you might have higher acuities of patients where they can become more they're more stable than ICU patients, but they can be unstable again at any time. So some of you guys might be wondering what to expect from orientation. Usually you will have a unit educator, and your unit educator will provide a list of competencies that you guys have to follow and check off with your preceptor. These are basic skills that you have to be good at or at least have encountered, and your preceptor will sign it off for you either in your clinical work, or maybe just have to look it up in Mo's. Okay, so some of you guys might be wondering what to expect in orientation. Sometimes you don't encounter everything in clinicals with your preceptor because you have a lot of things to worry about besides charting, learning how to memorize your policies and procedures and your protocols. So sometimes you're just gonna have to look it up in your Mosby skills, in your intranet, or in your internet resources. I really didn't know what to expect during my preceptorship. They first oriented me for like about 5 weeks during the daytime, and since I'm going to be a night shift nurse, and I am a night shift nurse, I trained with somebody else for about a month, and then I trained with somebody for another month and a half with a night shift nurse. Orienting with my day shift preceptor for about a month in 1 week, so 5 weeks. Obviously, she's going to look at your skills. You're going to try to get used to just the routine of the daytime and also your skills. You ask her if you need anything help with the IV pumps or the medication or the equipment that you guys have, and also get familiarized with the unit that you're in, where to locate things that you need, such as isolation stuff, passive stethoscopes when you have a contact room, where the code cards are, where the fire extinguishers are, all those types of things, for example. And also just the little tips and bits of your units that you're going to need to know as a nurse. And then when night shift comes, because I'm supposed to be trained for night shift, after training in days, I got trained in nights as well for about a month and a half more. Basically, overall, it was like less than 3 months of orientation or preceptorship, whatever you call it. And that preceptor was a little deeper, a little bit more critical about things that I do, on how to handle things, and she will give me bits and pieces. And I do know that other people out there will ask for a different preceptor if they don't get along well, or should they just need somebody more lax, or somebody need more assertive. And so don't be afraid to speak to your unit educator or your manager or your director if you have any concerns. And also, communicate with a preceptor straight up if you need something more or if you have a concern or questions, because take advantage of this time. I was shy, I was afraid to mess up in front of her face, but also I got to build that connection and bond with her where I felt like she was like, she was like my mother in a sense. Not only was she pregnant, but she was my like bigger sister, and that I could ask her if I needed help with something. And it was really good to communicate things with her so that she knew what I was thinking about. So before I would do something, I would tell her what I was thinking in my head, at least most of the time. That's how she wanted it to, and that's how I want it to, because I want to double check with things with her, but also it's like I'm confident after a while. So I'm going to tell her, this is what I'm thinking, and I think this is what I'm going to do first, and that 1 second, blah, blah, blah. And I'm going to go do this now. And I just shared her my tidbits on how I prioritize my time, skills that I struggled with, and things that I needed more help on. So that's what's really good about precepting. Don't be scared. Also, hopefully, you'll have somebody who's really nice and kind, and somebody that will teach you a lot. I do remember the first day that she was looking at the way how I give my injections, the way how I did my assessments. She just wanted to know that I did all my patient rights and I knew most of my medications and just the basic stuff. And from then on, your preceptor will probably trust you more, and she probably won't follow you as much anymore after a few weeks. It's just a process. Every person is different. Every student and educator is different. So good luck to everybody, and I know you can do it. After a month of training in day shift and I started training in night shift, I honestly thought it was very different because I was just not used to waking up patients and also it was more quieter and slower, and it was not as busy. But now I enjoy having that slower time, because in daytime you're getting pulled apart by all these other workers and doctors, but nighttime you get to have a one-on-one with patients more, even though sometimes they're asleep. But eventually you get used to waking patients up for their medications in the middle of the night, their insulin shots at 9 p.m. or 2 a.m., and also their Lovenox shots, especially because I'm in a stroke unit. Basically, I'm kind of a stroke nurse, and we want to prevent clots, and PE especially being more immobile in the hospital. And honestly, day shift is it's different from night shift, because day shift they're more busy, PT and OT is gonna bother you, and the doctors are there, usually easier to ask for questions because they do run in the mornings, whereas night shift where you have to call a doctor. In night shift, you're gonna have to call the doctor up if you need an order for a medication, or if you have a question regarding an order, or if you're concerned about something, or if you have a diagnostic result that you want to tell them, or something new that might have changed in your assessment. So in that 3 months of training, I had to learn and refresh all of my skills and all of my knowledge, and also get used to my hospital's policies and procedures. And even until now, I don't know everything yet, but now that I am working alone, I don't have a preceptor, because they did cut me off early and they thought that I was ready to start working alone in about 2 months instead of 3 months. So everybody will have their own progress, and it depends on where you work at, how much they need you. My point is, if you don't feel comfy to start working alone by yourself, then ask for extra time. But if you feel okay to be alone, go ahead. Be a team worker, and of course, don't be embarrassed to ask your charge nurse or your manager or other co-workers for help if you're behind or if you are second thinking yourself, because it's always good to double check with them. I still do that, and I stay friendly with them, and also I ask them for help or for suggestions if I need to double check something, and I also offer them help too if they need something as well. You know what, guys? The first 3 months is not the easiest, okay? Because even other nurses will tell you that they remember their first year, and it's just one of the hardest. There's moments when I feel still very anxious to go to work. I tell my family that, I tell my boyfriend that I feel anxious because I'm in a very tough unit. Neurotele, if somebody comes in the ED having an altered level of consciousness, either from a UTI or having seizures or having no medication compliance, they're probably going to go to the neuro unit. Also, not only that, but they also have heart problems, which is very intense as well. Sometimes they can also transfer from the ICU unit too, which they might seem more stable, but sometimes patients can become unstable at any time all over again. So even though it is very challenging in this unit, I do love it, but it does take a lot of patience. Some patients can have mental problems from liver encephalopathy, or maybe a history of dementia, history of AFib, all types of things. Maybe they're controlled or not controlled. So it is a lot of things to think about, especially during nighttime when patients can be confused and you have to worry about their safety and precautions, their bed alarms, and their memory. Seriously, in the first 3 months of being in orientation with a preceptor and being the first 3 months of being alone, you will learn so much because your learning curve is just so steep. Your skills, your knowledge. If you think you had customer service, well, you're gonna push your customer service experience even more, and your own patience, your own doubts and abilities, you will have a lot of those to think about. A lot of knowledge, skills, and critical thinking. You're gonna have to sharpen your mind, and also definitely your emotional capabilities, depending where you work. Not only in your work life, but also in your personal life, you're gonna have to adjust a lot. And what I mean by adjusting in your life is that you need to know how to prioritize your schedule, just like nursing school, and also how to decompress and handle your stress factors, because you will be stressed out learning all these new things. And also another thing is just having the responsibility of taking care of other people's lives and having them look up to you, having their families look up to you, and having them ask you questions. And sometimes they can tell you're new and you might get intimidated by that, but don't let that intimidate you, because you know that you've been through a lot and you should be prepared for this. Also, don't be scared to admit if you don't know some things. Tell them that you will find out for them, and you do have to be humble because you are new. Even until now, I'm scared what kind of family I'm going to encounter, what kind of patient I'm going to encounter, what kind of mental status they're in, how stable they are. But at the end of the day, I try to stay positive, even though sometimes I don't get to pee, sometimes I don't get to eat. I stay positive and I go back home to my family. That's all that matters. Also, even though sometimes I get busy, I make sure to familiarize why my patient's in the hospital, what their story is, what they're there for still, and what the plan of care is, because the doctor and your charge nurse are going to want to know why they're still there and what the next step is and what you can do as a nurse. So I make sure that you have your brain sheet ready and you do well with your medications and your tasks and your So when you give report to the day nurse, make sure that you give them handoff on what's pending and what the next step is, and also what you assessed with during the nighttime. You can tell the day shift nurse any questions you have, since they do have easier access to talk to the doctor sometimes because they are around more during the being a new nurse is not easy. You feel proud finishing nursing school, but sometimes being a nurse, you will feel like you doubt yourself. I remember one time I got bumped up to 5 patients, even though they try not to do that, and I just felt like I could not do it at all. I feel like I couldn't do it anymore. I just wanted to give up. Having 5 patients is okay, but when one patient goes unstable on you, then you kind of get behind in in all your work and just your assessments, and you feel like maybe you're lacking something and you start doubting yourself with other patients. So it is better to have those nursing staffing ratios, but sometimes there is an emergency or something happens in a staff and your team, so you're just gonna have to be ready. You will doubt yourself, you will doubt your abilities, you will be nervous to go to work, but to be a nurse, you need to have the emotional capability, especially working in my neuro tele unit. A lot of things go down. There will be moments where you don't want to go to work, and sometimes I tell my boyfriend that I'm like, I don't want to go to work today, but at the end of the day, you get out of it and you feel proud of yourself. You will feel proud of yourself, and it's just a mix of emotions, because there's days when you feel disappointed in yourself, proud of yourself, feel happy, excited, feel angry at yourself, sad, but overall it's gonna be satisfying. Just like nursing school, the first year or first month is going to be a roller coaster ride, and it's not gonna be easy. It's gonna be all sorts of emotions you're gonna go through, just like you did in nursing school, and you're gonna be proud of yourself in the end. No matter what unit you're going into, no matter what place you're going into, labor and delivery, NICU, ER, tele, med surg, or oncology unit, you're going to go through a lot, and you're going to feel like a fish out of water. Even an experienced nurse will say that if they go to a new place. So you just got to stay positive and do your best. And that's why I'm making this video right now, because I want you guys to know what to expect during your orientation or your first few months of working, especially when you're working in an acute place. It can be hard, and you just don't know what to expect. Because, having your new job is very, very exciting. Getting out of nursing school, passing your NCLEX the first time or after a few times of taking it, it's very exciting and rewarding. So having your new job after all the interviews and applications should be a very positive thing. It should be a very positive thing, even though it can be very blurry and it can be hard to stay positive at difficult times. Just like one time I almost gave up after having 5 patients, and I told myself that I couldn't do it anymore. I wanted to get out of there just because one patient goes unstable. But actually, you push your limit, and you'll feel proud at the end, because you know that you can handle yourself and other people's lives. So again, I just wanted to tell you guys that I am very proud of all of you nursing students and new nurses, new graduates, that I believe in you, and you should believe in yourself, and you have to keep going no matter what experiences you face, and you gotta stay positive, okay? You got it. Overall, don't let anybody ruin your flow, because some aides or some patients or family are going to know that you're new, and they might say something about you or try to take advantage of you, or trying to feel like maybe you're not good enough because you're new. But You gotta be confident and you gotta know your stuff and let them know that you are there for them. Again, teamwork, positivity, determinations, perseverance, and some type of self-confidence will get you far enough in nursing and you will be able to attain your goals. Good luck, everybody.